Kicks 105, good morning. It's the Merrell in the Morning Show as we continue what we call a takeover so that we can kind of shed some light on the wonderful things happening at CHI St. Luke's Health-Memorial in Lufkin. And I am honored to be joined now by phone by Dr. Valerie Moore with Texas Children's Hospital. She, and I know I'm probably going to butcher this, doctor, but you can possibly help me along the way because neonatologist is not something I say very often. So you've been involved with that for some 30-plus years now, you said?
Yes.
Okay, and you are the medical director of community initiatives there as well.
Yes, it's medical director of Texas Children's Community Initiative.
Okay, very good. So thank you so much, first of all, for joining us this morning. This is such a great time in Lufkin to be a part of this. Explain how this partnership with St. Luke's Health-Memorial Lufkin works. Texas
Children's and CHI St. Luke's Health System has a long-standing relationship. The partnership with CHI St. Luke's Health-Memorial is our fifth partnership with CHI St. Luke's Hospital in the greater Houston area and beyond. Texas Children's brings programs and services to CHI Memorial to support high-risk mothers and babies' needs. The hospital has access to a complement of Texas Children's services, including comprehensive education and training programs for the nurses and healthcare team members. We believe in keeping babies and mothers together as much as possible in their communities by providing the right care in the right place at the right time, even when the baby has critical needs. Texas Children's provides oversight of the medical management in the neonatal intensive care units at our community partner hospitals. Should babies need more intensive care, we are prepared to transport them to Texas Children's, where we have the most advanced technology and experts to support the sickest of the sick infants.
Gotcha. And what makes this partnership so important to Texas Children's Hospital as well?
We're excited to partner with CHI St. Luke's Health-Memorial because of our CHI relationship. It fulfills Texas Children's mission to create a healthier future for children and women throughout our global community. Through our presence, we will elevate the standard of care not only for CHI St. Luke's Health-Memorial patients in our care, but in this community as well.
Now, is this kind of a new trend that's been going on with this, the NICUs, that where the larger hospitals are partnering with the smaller hospitals to provide the specialized care?
For Texas Children's, we started our Community Initiatives program with St. Luke's Woodlands Hospital opening in 2003. Texas Children's Hospital is committed to influencing care through these partnerships. Because neonatal and maternal mortality rates are high in the state of Texas, lower-level hospitals with limited resources must align with larger hospitals with more advanced care to support high-risk and critically complex babies.
Right. Now, let's talk about how this partnership is going to affect the local community here in Deep East Texas.
Texas Children's offers some services in addition to neonatology at CHI Memorial to address the needs of mothers and babies. Maternal fetal medicine specialists from Baylor College of Medicine in Houston work closely with obstetricians to consult mothers with high-risk pregnancies through the telemedicine services. This has been a great benefit for pregnant mothers who would have had to travel to receive these consultation services. Texas Children's cardiologists in the Houston area can read studies on the heart through telemedicine. Texas Children's works with the hospital to tailor services to meet the needs of the patients and families.
And so I hear about this being a level 2 neonatal intensive care unit. And can you kind of expand on that? And when is an admission to the NICU most often required?
Okay. I'll be happy to answer that question.
Okay.
A level 2 neonatal intensive care, otherwise referred to as NICU, accommodates babies born prematurely, and those babies are usually greater than 32 weeks and weigh about 3 pounds, and infants with high-risk conditions and illnesses. These babies need close observation and continuous monitoring. Hospitalization may be required in the NICU for a few hours for stabilization, a few days, or a few weeks, depending on how early they are born and the severity of their condition.
And let's talk about some of those conditions. What are the types of health problems that you treat there?
breathing problems, infection, feeding problems, managing the extremely sick newborn with complex medical or surgical issues until able to be transferred to a higher level of care.
And what kind of specially trained experts do you have available?
We have our group, our neonatologists have received special training through neonatal fellowship programs. We have completed a pediatric residency, and then we have gone on to have fellowship training, which is about 3 years, and then we have board certification. Our team is composed of experienced board-certified neonatologists who will care for the NICU patients at CHI Memorial Hospital.
You know, you hear all about these awards, these recognitions that St. Luke's Health Memorial gets, and of course, Texas Children's Hospital as well. And I know that's part of the reason why that people should choose, whether it be Texas Children's Hospital or St. Luke's. Can you go deeper into that? Why should they choose that for their NICU of choice?
NICUs vary in their capabilities and support provided to critically ill infants. Texas Children's Community Initiatives Program provides neonatal, pediatric, and maternal fetal medicine services to community hospitals and focuses on improving outcomes. Texas Children's is the largest pediatric hospital in the nation, and the Newborn Center at Texas Children's in Houston is the largest and houses a level 4 NICU, which is the highest level available for providing comprehensive care for newborns and infants. Families can be assured their baby will have access to some of the nation's top experts in neonatology and subspecialty support.
It takes a special person full of love and patience to work in some place like that.
Yes, it does, and we love what we do, and it shows. We love working with our families. We bond with the care team, nurses, all the ancillary services, and it gives our heart warmth to see a baby that we started from admission to discharge. And we always try to maintain some communication. We encourage it. They don't have to. Parents don't have to. But we love to hear how they're doing once they've been discharged from our care.
Fantastic. Anything else you wanted to add?
We are beyond excited about this journey with CHI Memorial Hospital in Lufkin. And we look forward to this in many more years to come and advancing and developing the unit into a unit that everyone will be proud of.
Very good. Dr. Valerie Moore, thank you so much for joining us today.
And thank you for having me.